big changes are underway in England's healthcare system. In a major shift, spending on agency staff across the NHS has fallen by nearly £1 billion over the past year, a move that could reshape how hospitals operate and how care is delivered. According to the Department of Health, NHS trusts across England dramatically reduced their reliance on agency workers during the 2024 to 2025 financial year, fulfilling a pledge by Health Secretary Wes Streeting to cut agency staffing costs by 30%. For years, hospitals have been filling staff shortages with agency workers, often at a much higher cost. At its peak, agency spending had ballooned to nearly £3 billion a year, straining NHS budgets and raising serious concerns about sustainability. Last November, Streeting publicly criticised the system, calling for tighter rules. One of the proposed, though not yet implemented policies, includes banning agencies from supplying workers for lower-tier roles like healthcare assistants and domestic support staff. Another controversial point, stopping NHS employees from resigning and rejoining immediately through agencies just to earn higher pay for the same job. This loophole, while beneficial for individuals, costs the system dearly. Aside from agency workers, NHS trusts also rely on bank staff, internal employees who take on extra shifts. Together, agency and bank staffing have cost the UK health system over £10 billion annually, according to early 2024 reports. In response, Streeting and NHS England's CEO, James Mackey, have written to hospital leaders. Their message: all providers must aim for a 30% cut in agency use, or face potential legislation in the future. The push isn't just about cuts, it's about sustainability. Officials want pay rates for internal bank shifts to be competitive, but not inflated beyond agency rates. The goal: fairness for permanent staff and better use of taxpayer money. NHS England's Chief Financial Officer, Elizabeth O'Mahony, reinforced the message, saying the reforms aren't just about saving money, they're about improving frontline care, reducing waiting times, and building trust with patients and staff alike. As the NHS faces growing demand and tighter budgets, these staffing changes mark a turning point. Whether this £1 billion reduction leads to long-term improvements, only time will tell. If you found this update useful, hit the like button, subscribe for more health and policy news, and let us know your thoughts in the comments below.